Hi, I'm Nurse Bob, and today I'm going to talk about the liver. I'm going to talk about what it is, where it is, and what it does, and then briefly about what happens at the end of life. What's the liver's role and what happens when it's not working well. Although I'll save the bulk of that for the final segment, which will follow this, and we'll talk in depth about what really happens when the liver's not functioning well and we're dumping a bunch of stuff into the bloodstream. So it's time to get started on that. I'm going to wander off to the whiteboard and scrawl some stuff on that, and we will talk about some bullet points, or whatever you want to call them, but talking points perhaps. So looking forward, and let's try this again. As I mentioned, I'm going to talk about what the liver is. I'm going to talk about what does it do and what happens near the end of life. What is the liver? Well, it's an organ, and it happens to be one of the largest and most complex organs in the body. It has a whole number of different jobs. So it's located in the upper right-hand side of your abdomen, and it actually extends all the way across over the stomach. It's tucked up just under the ribs, and that's about all there is to say about where it is. So back to the whiteboard, and let's talk about what it does. What does the liver do? Well, it has multiple functions. It participates in digestion by absorbing most of the fats and some of the specific vitamins from the digestive tract. And it then helps distribute those nutrients throughout the body. Basically, the liver has a rather unique circulatory system in that it gets all the venous blood from the intestines and the stomach, and it filters it for all this good stuff. It separately has another artery that feeds it so that it gets its own nutrients and oxygen. But basically, it pulls all this stuff out of the blood and sends it off for the heart to circulate around the body. And it also works as a filter. It helps to clear the blood of medications and toxins. And in many cases, the medications we take actually depend on the liver altering them before they become effective. So it's really quite some very interesting physiology. And it manufactures some really important proteins, such as clotting factors. It plays a role in whether or not our blood clots effectively when we're cut. And it makes albumin. And as we've talked about before, albumins are really important. It does a lot of stuff. So we'll get back to that in just a moment here. But before I do that, I want to stop and talk for a moment about, or make a little aside here, about how the liver really functions. Okay, so before I get into what happens near the end of life, but while we're still on what does it do, there's an important note I want to make about the liver. And that is, all of the functions it performs compete with each other for the liver's resources. So what does that mean? Well, it means that when one of the functions demands more of the resources, the other functions suffer for it. Their capacity is diminished in exchange because there's only one liver. If we're drinking too much alcohol, or taking in a lot of medications or drugs, or we're very ill, all of these things impact the liver, and it's less able to do any one job effectively. And ultimately what happens is, particularly the protein manufacture falls off, and that means we make less albumins. So what does that mean? It means it's time for me to go back to the whiteboard. We'll draw some more, I'll write some more talking points, and today I'm not drawing any pictures, which is probably best for all of us. Okay, back from the whiteboard. Let's talk about what happens near the end of life. Due to the disease processes and all the medications that someone is taking, the liver focuses its limited energy on metabolizing the drugs and dealing with the byproducts of the disease process. What does that lead to? Well, one of the things, it reduces the liver's ability to pull nutrients out of the digestive system, and therefore, we already are having nutritional losses. So just when we need it most, we're less able to use the food that we're taking in. It also, of course, reduces the production of albumin and clotting factors. And with the clotting factors, you may have more of a risk for strokes or, other bleeding issues. And of course, without the albumin, we start getting fluid shifts, or certainly it can lead to fluid shifts. One of those is called ascites, and that's where the fluid actually accumulates in the abdomen. It's due to fluid leaking through the liver's tissue itself. And, it sort of looks like you're pregnant, but you're sloshing full of fluid instead. As the blood is less able to hold on to the fluids, it leads to edema, which we talked about in the last segment. The fluids in the blood head into the tissue and accumulate there, and then that can lead to a condition called anasarca, which means it's just a generalized edema, and if it's really severe, sometimes there's weeping and blisters. So, it's a big deal. So what are we going to do now? Well, that's kind of what I wanted to cover for today. As I said, the goal here was to talk about, what's the liver, what does it do, and what happens near the end of life. So I've covered that for now. So the next segment we will talk specifically about TPN, total parenteral nutrition, and what goes on at the end of life. And, now that you know about the liver and osmosis and a bunch of these other things, you'll be better able to understand what I'm going to talk about with pumping fluids and amino acids and proteins and sugars and everything else into the bloodstream when the body's really not able to use it. Thanks for your time, and I'm Nurse Bob, and we'll talk soon. Thank you.